Good day guys, my name is David and today we'll be talking about inserting a nasopharyngeal airway tube. What is a nasopharyngeal airway tube? Now, a nasopharyngeal airway tube is a type of airway adjunct and it is a tube that is designed to be inserted into the nasal pathway to secure an open airway or ensure free passage of air. Now we'll talk about indications of nasopharyngeal airway tube or who can use it. People who are conscious and semi-conscious can use a nasopharyngeal airway tube. People with reduced GCS, this is the Glasgow Coma Scale, from the ranges of 1 to about 5 can use it. People with intact gag reflex can use it. People with respiratory distress like tachycardia, people with difficulties whilst talking can use it. And also people can use it when the oropharyngeal airway tube is very difficult to use or very technical to insert. Now we talk about contraindications of the nasopharyngeal airway tube or people who cannot use it. Now certain people cannot tolerate it because when it passes through the nasopharyngeal pathway, it is kind of irritating. So certain people cannot tolerate it, so those people should not use it or do not use it. Also, people with severe head or facial injuries, for example, somebody with a basal fracture, cannot use it. Now for this process, we make use of two very important materials or equipment. First of all, we have the nasopharyngeal airway tube with the bevel here, and secondly, we have the ventilator. Good day, madam. How are you doing today?
I'm fine, thank you.
Today, ma'am, I'm here to insert a nasopharyngeal airway tube into your nose. Is that okay with you, madam?
It's okay.
Madam, now I know it may cause a little discomfort, but I'll ensure to minimize that to the best possible way I can. Okay, madam?
Okay.
And if perhaps it gets too uncomfortable, please try to let me know, okay?
Okay.
Thank you, madam. Now, the first step to do is to measure, to choose the correct size of the nasopharyngeal airway tube. And you do that by measuring, by comparing with the nares of the patient. So you take the nasopharyngeal airway tube and you choose a nasopharyngeal airway tube that is just slightly smaller, that has a diameter that is slightly smaller than the patient's nose. After you've determined the diameter, the correct diameter, you then measure the length from the tip of the nose, right, to the tip of the earlobe. Or some people measure from the tip of the nose to the angle of the jaw. After you've done this, you're doing this so you can determine the correct length. After doing this, you take something, some people use water, while some people use a water-soluble lubricant, and you lubricate the distal surface, which is this part of the tube, and then you insert. So when you insert, you follow the anatomical curvature of the nose. So in this case, it's not really possible, but you just follow nicely by following the anatomical curvature of the nose, and you direct the tube towards the floor of the nose to the oropharynx. And when it goes to a certain point, you have to rotate the tube in a 180 degree so that you can resume alignment with the normal anatomical curvature of the nasopharynx and the nose. And you continue to go into the oropharynx. And once it is in place, the last step is to take the ventilator and cover And the last step is to take the ventilator and place it to allow adequate air exchange for the patient. After this, you thank the patient and you leave the room.